Welcome, everybody. Thank you so much for being here. We are so happy to have this turnout and to have all these community partners, community members here tonight. I'm going to hand the mic over to Commissioner Pogue, who's here to get us kick-started here for the night.
Thanks, Kellen. Hi, everyone. I'm Tamara Pogue. I am one of the 3 Summit County Commissioners. And as commissioners, we like to divide up different topics. And so behavioral health is something that I have been passionate about for, probably 15 years, long before I was commissioner. I want to say a couple thank yous tonight and then a few other words, but I'll be quick. First, I want to recognize Dick Carlton, who's a member of the Breck Town Council. Breck has been a great partner for the county and all of the partners who are here tonight in the area of behavioral health and particularly opioid abuse prevention. Certainly want to thank Building Hope for pulling this together. As a parent, the best thing we can do is arm ourselves with all of the services that are available in our community. And so I'm really happy to see how many parents are here tonight. And in Summit County, we've come a long way on this front in a very short time, largely because the voters of Summit County saw fit to create the Strong Futures Mill Levy, which funds about $2.5 million a year specifically for behavioral health. So many of the providers you'll hear from tonight and many of the services that you and your family may access at some point are in part funded by that mill levy. And that sets Summit County apart from a lot of other communities in Colorado. So I will stop there. We have many partners here tonight. I am grateful for all of them and the way that they wrap their arms around everyone in our community whenever somebody needs that. And at the end, we will have questions. So we'll look forward to hearing from those from all of you.
Thank you, Commissioner Pogue. A few housekeeping items I'd just like to address really quick. Obviously, we've all enjoyed La Perla for dinner tonight, so thank you so much, La Perla, for being here. If you haven't gotten food yet, I'm going to stop doing that. Please go ahead and get food. Don't feel badly about getting up. If you want to refill your plate, please take advantage of them being here. They'll be here until about 7:30, I believe. There are bathrooms in the back out these 2 doors. If anyone needs anything, please feel free to get up and excuse yourself at any time. Thank you to the Community and Senior Center for being here tonight. And if you need live interpretation or translation, we have that as well. That's available outside those double doors. And some kind of just house rules for the night, for this evening. Please remember to be kind, be thoughtful, be considerate. Let's be non-judgmental, respectful, and compassionate of one another. We are really here tonight to be able to talk about our resources in the community, to partner together, to talk about how we can support one another around our mental health and support our community. I know that we are grieving as a community, and sometimes grief can bring up very complicated emotions. There can be sadness and guilt, blame, anger, frustration, confusion, lots of different things all at the same time, and it's okay to feel everything. We want to be able to be here to listen to everyone tonight, to get feedback, to answer as many questions as we can. And we also understand that there may be some questions that we're not able to answer, and we please just ask that everyone be respectful of that and just understand that there's only so much that we can answer and do tonight, and we're here to talk about supporting one another. I just also want to recognize that we're here to discuss resources. We have lots of different resources that are here tonight, different partners, the school district, Mile High Behavioral Health, the Summit Community Care Clinic, and many more. We also have private practice therapists who are here to support us tonight. So if you guys can come up, we have Lynn and Michelle, or just raise your hand if you don't want to come up. Lynn, Michelle, Casey, Stacy, and Nicola, wherever you are as well. So these therapists are on site tonight to be able to support us all. If anyone is having a problem or having a challenge or struggling with something that might be brought up tonight, please feel free to excuse yourself, and the therapist will be around the room. They will be able to help. There's private rooms outside that people can help process if there's anything that comes up. So please take advantage of that support, and thank you, therapists, for being here tonight. So I'm here tonight from Building Hope. My name is Kellen Ender, and I am the Executive Director of Building Hope. And show of hands, who knows about Building Hope? Oh my gosh, woo, look at that, that's amazing. I'm so glad to see that response. We are a local nonprofit here, and it is our goal to do events like this. It is our goal to support the community and to talk about mental health services and be able to provide access to care. We do that by a number of different programs. We also reduce stigma in the community for mental health. We want to be able to talk about our mental health. We want to be able to know what to say, how to address people, how to help support one another. And so that's really our main focus. And as we come together, as Building Hope came together in 2016 and became our nonprofit in 2019, it was really important to come together as a community, as partners and stakeholders. So Building Hope does not do the work that we do alone. We could never possibly do the work that we do alone. It is only with our partners that we can make a difference in this community. So our scholarship program is where Summit County residents and employees of Summit County residents or workers are able to access up to 12 free sessions of therapeutic care. Anyone who's in a financial barrier or who identifies a financial barrier to accessing that care is eligible for this resource. It's really important that our community knows that this is available and takes advantage of that. We have Spanish-speaking therapists and we have English-speaking therapists, and we try to provide more support to the community and capacity to the community. We started with probably about 40 different therapists in our community and that were accepting our scholarship, and now we have over 100. And we are partnering with Eagle Valley Behavioral Health, Vail Health Behavioral Health, who you'll hear more from later tonight. And that expansion is going to happen to over 200 therapists that are going to be able to gain access to mental health support. We also do community connectedness events, which is really just about supporting the community in a soft mental health. So we have events that are fun, engaging, free, for all of the community to take advantage of. And this is because Summit County can oftentimes be an isolating place to live, can be a hard place to connect with one another and to meet new people. And we know that that goes hand in hand with depression and anxiety and struggling. And so Building Hope's mission to bring people together and connect, it happens through those connectedness events. Those are offered in both English and in Spanish. And we also have youth-specific programs that are specific to our young people ages 12 to 17 years old. And those are really fun and really engaging, always free and always full. We also provide mental health trainings, and so we do these for organizations, we do these for different cohorts. We will talk to anybody about mental health that will listen to us. So if you have an organization or you have an entity or you yourself just want to learn more about the resources in Summit County, reach out to us at Building Hope and we will train and we will talk to you. We do QPR training, which is a suicide-specific prevention training, mental health navigation, which is our own local resources and sort of a mental health 101 training, and then we contract with providers to do Spanish and English mental health first aid. We also have a volunteer peer program where if somebody is not necessarily ready for therapy or who has a therapist, but they just want to talk to somebody who's been through a lived experience, who's gone through something similar that they have, you can call our Building Hope line and access a peer, somebody who has been through a challenge, an addiction, a support of some sort of role. They have been through a training and they are there to support through empathetic listening and care and resource allocation. So that is a very newer program in 2020, and so we are thrilled about having that support available. Also new program to us is our immediate access program. We collaborated with the school district, the SMART team, Building Hope, FERC, Summit Community Care Clinic, and Mile High Behavioral Health to put this together. We know that when people are in a crisis, which is what we're here to talk about a lot in part today, is that when somebody's in crisis, they need to see a therapist quickly. And we were finding that there was a problem with that wait time. We were not able to get clients into care, so they were having to go down to Denver or out of the county to be able to receive access to care. They were getting into programs that were not really sustainable for them because they're having to go out of the community that they're a part of. And so we created these immediate access slots to be able to partner with our private providers so that there is always a slot available, and I call a slot a therapy appointment, available in Summit County every single day of the week that is available. So at least 1 to 2 slots available per day. So if you have a crisis or you have somebody who's in need, there is a guarantee that the next day or 48 hours from that time, you will be able to get an appointment in our community, which is really, really important and has been a great, great access point for us. Some of the safety net services, we're here to talk about safety net and crisis. We have done a lot of work around our wellness and recovery. The Summit Wellness Hub, Mile High Behavioral Health, and Front Range Clinic provide those treatment services. Front Range Clinic does medication-assisted treatment, which helps with opioid and alcohol addiction and getting people clean from those. Mile High Behavioral Health does intensive outpatient services, so more than just outpatient, 1 appointment a week. They do multiple appointments a week for mental health, substance use. They specialize with teens and LGBTQ. And we've also done a lot of expanded outreach with our Spanish-speaking community, which is really important to us as well. Lots of mental health and suicide prevention trainings. Withdrawal management is also a new program that we have been able to access and have available here in Summit County. We've always had it, but it's been very intermittent in the care that it was able to provide. And now we have a service provider in Recovery Resources who's able to stay open and available to the community consistently. We've done a lot of work on workforce retention and retainment. We know that Summit County can be a difficult place to live and work, especially in the behavioral health community. And so we want to do more to support our behavioral health providers and be able to keep them around and build that capacity for our community. We've also helped to expand mental health navigation, which is in case you don't know where to go. The mental health system is very hard to navigate, even for somebody who works in this field. There's a lot of different acronyms and resources and things that can be very confusing. So we've built navigators at the Family and Intercultural Resource Center, at Building Hope, and at the Summit Wellness Hub. There's case management and peer support. Our co-responder services within the Summit County Sheriff's Office, the SMART team. We also have professional development at Building Hope. It's really important to us that we, again, support our therapist community and our agencies who are doing the work. Building Hope, we contract our providers, so we don't provide therapy. We look to our therapists, we look to our agencies, we look to our support people to do that work. And so we provide supervision grants, training grants, professional development, group support, and funding for those programs. We also have outpatient urgent care with the immediate access slots that I mentioned, and more adolescent supports with Wild Youth Passages, which is an experiential-based program that offers 2 different groups for 12 and 13-year-olds and 14 to 17-year-olds, and that is for high-risk individuals who are having a hard time with suicidal ideation, self-harm, and who are struggling kind of on a day-to-day basis. And they get to go for hikes and summit peaks and do lots of different experiential activities that really get them into the meat of their feelings and how they're experiencing their challenges that they're going through. And we also have DBT groups and lots of various teen groups to find out more about at Mile High. And I just want to talk briefly about our safety net services that are a work in progress here. There's always more work that can be done. There's always more support that can be offered. And we know that we have built a much more robust system of care here in Summit County than we've ever had before. I've been here for almost 13 years now, and when I started, there was just a handful of therapists that were doing some work and doing what they could. And now we've got so many agencies, so many support services, and we're all working together a lot more collaboratively than we ever have. So we want to continue to expand that behavioral health outpatient care. We're collaborating more with Vail Health Behavioral Health. You'll hear more about those services, and we're so thankful to have them here tonight. And we're in the process of looking for a provider to come into our community and develop an assertive community treatment team, a community stabilization program, mobile crisis response, and community crisis response. so that when an event like what brought us here tonight takes place, we have providers, we have an agency, we have support that's available to us. And we also have community stabilization and an assertive community treatment team that will help us not get to a place that we're at tonight. It will help the events that took place on July 9th not take place anymore. We are securing startup and operating funding for a crisis walk-in center currently, and we have Casey from the hospital who's here tonight, and she can answer any questions about what that looks like from the hospital perspective. But right now, when somebody has a mental health emergency, oftentimes they head straight to the emergency department, and we know that that's not the best receptive place and the most accessible place for a mental health crisis to take place. And so we're trying to develop a crisis walk-in center that can take that load off of the hospital and also be a more responsive place for the community member that needs support. And we're looking to create a system that ensures secure transportation for individuals who are on a mental health hold. So somebody who has a need that's greater than what we can provide in the community, if they need to go to an inpatient hospitalization center, they can access that without having to be transported through an ambulance or a police car or something like that. There's a secure transportation that can take them in a more client-centered way. And I just want to talk a little bit about the community response that we've offered at Building Hope in partnership with all of our wonderful partners here tonight. After what happened on July 9th, we were able to pull together community support to have walk-in appointments and walk-in sessions that therapists were there to provide for anyone who was going through some sort of trauma and grief related to what happened. We also provided walk-in support specifically for teens. And that was really helpful to also our therapist community. And here tonight. So I want to say thank you once again for being here tonight, for supporting your community, for coming out for something that's so meaningful and important. And we have a few upcoming events that we're hoping to just let the word out as well. There's a class tomorrow night that's a Light Within the Darkness painting class. So if you're interested, or I'm sorry, not tomorrow, August 16th. Sorry, I misspoke. That is going to be available. It's an intuitive painting process, and if you've never been in a class with Kathy Conti, she is absolutely remarkable and will really access points that you didn't know you had available. And there is also a young lady who is putting together a remembrance event for Charlie Foster, and so we just want to help support her in her efforts as well. With that, I will again say thank you so much. We are going to have time for questions at the end of our presenters. I have a few more presenters that are here tonight to talk with you guys about various different crisis resources. And so with that, I will hand it over to Meg from Rocky Mountain Health Plan. So thank you, everybody.
Thanks, everybody. I'm Meg Taylor with Rocky Mountain Health Plans. This is the CEO of Rocky Mountain Health Plans who is always chomping at the bit to say something, so I told him he could come up here with me because he will be itching to say something. So Patrick Gordon, CEO of Rocky Mountain Health Plans. So I just want to say, first of all, thanks for everybody coming tonight. Thank you, clinicians, therapists, peers, parents, support, partners. It takes a community to do this work. And thank you for welcoming us to just talk about some of the things that hopefully how Rocky is helping and what we can do and how we see us, our work supporting you all and what you need. We're definitely here to hear and listen, but we did want to provide just some updates about things that are happening in the community that maybe can spark some questions or dialogue about what's happening in the behavioral health space. I also just, Kellen mentioned stigma. I don't know the statistics, but I do know that stigma continues to be a major barrier in people accessing behavioral health care. I would say it's gotten a little bit better around things like depression and anxiety and things that we kind of feel like are maybe more mainstream. Substance use disorders are still something very hard for people to talk about. And I just really encourage people, especially people in leadership like myself, to maybe talk about maybe their own space in the mental health world. Not so that I'm relatable or that I have lived experience, but just I often hear leaders talk and they point to maybe their daughter or a cousin or a friend that had a mental health struggle. But as leaders, I think we should be talking about our own stuff. I was in residential treatment when I was 9. I had incredibly postpartum depression that probably should put me in the hospital, but I was too scared to tell anybody because I didn't want my baby taken away. And that depression and anxiety has continued, and my kid's now 15 years old. So we all struggle, and we should talk about it because that's how we create community. I know sometimes it's super hard. Again, especially substance use disorders are very hard, but they are real. They are medical, they are physical, and we need to help people when they say, I have something I need to talk about. We need to show up as much as we can, putting our judgments and our beliefs and our values aside to help people. And so I just really encourage all of us to do that in this space. All right. Kellen. Kellen. All right. So we really just wanted to touch on a couple things. One, behavioral health in the community. We cannot do this work without community engagement, and we are all part of the community, either living here or being partners and providers that support the communities. We are here today because a tragedy happened. But there are also opportunities ahead, and I want to know how we can support those opportunities and what we're engaging in around those opportunities. I'm very scared of this thing. Patrick, I'm going to hand this over to you because this is something I think you wanted to talk about.
Sure. You know, there is tremendous evidence that a community approach to mental health is not only more effective for individuals, but improves the overall well-being of the community. And you know, I just found something that I thought was very reflective of all the leadership and all the work that has gone on in Summit County for years. Working hard to create adequate and ongoing resources. The mill levy is just the start. This community is self-generated and generated its own trajectory, its own strategy. Learning and training, shared learning. You know, that's a community process. Again, there are resources here that weren't here a few years ago because of leadership and people being willing to give. That's a fabric strengthening process. Building trust, that starts with confronting the truth and owning what happens. So if programs aren't working, if they aren't delivering, if leaders are saying one thing and doing another, if they're not connected to stakeholders, if they're not hearing from families and individuals, you know, this process can't work. And then of course, creating active partnerships, very much like the Summit County and Eagle County communities have done. And not only just working in your own community, but driving public policy. So Commissioner Pogue and many of the people in the room have made impact at the state level, and that's a critical part of this success. Okay. So these are high level, right? I really appreciated the Building Health presentation because there's more to talk about than can be summarized easily, but we have been really focused on closing gaps and frankly working in advocacy with the state, working with our own programs to serve as a more effective backbone for this community. We're going to talk about some of these things tonight, particularly mobile crisis response. But when you look at the data that we're beginning to collect, it's very, very telling in terms of how the communities are performing.
So I am making a concerted effort not to read slides anymore, or to say you can read the slide yourself, because actually some people can't read the slides themselves because of visual impairments, blindness, or other learning difficulties. So if you catch me saying you can read the slides yourself, raise your hand and tell me how to say that. But through Building Hope and all the people that are in this room doing this work, the Independent Provider Network has grown exponentially in Summit County. Partly because you had to, because you were being underserved. And I will call out that elephant in the room that's not so much an elephant, because you were. Summit County was being underserved. Thank you, Building Hope. Thank you, Commissioner Pogue. Thank you for the work that you did to work around a system and basically create a new one. We are very excited that the Community Mental Health Center now for Summit County is Eagle Valley Behavioral Health, and I believe that somebody here is going to talk about those services and the expansion of Summit County. We are already seeing increase in access to care because of Eagle Valley Behavioral Health's presence. We can answer questions later, either formally or informally, about substance use disorder programs. Rocky Mountain Health Plans is now the managed service organization in Summit County. It used to be an organization called West Slope CASA. We are leaning in to figure out how we better support substance use disorder treatment, recovery services, and prevention, including things like recovery housing that we can actually pay for as a managed service organization. So if you didn't know that, now you do. And I'm happy to answer questions about that as well. We also have children and youth programming under our contract with the Behavioral Health Administration, who's also here. And that is paired with our mobile crisis response contracts that we hold as well. So we are working with, taking the lead from the community and the stakeholders around what this needs to look like going forward. We listen to the community. We have to follow contract requirements, but we really want to partner around what this looks like. What does the community need and what does the community want? And then just getting back to partnership and investment. Like, this really is about partnerships. It's about trusted partnerships. Where we can invest, where we can support, that's how we want to show up. We want to take the lead from you all and how we can support this community now and moving forward. One of the things I just wanted to touch on is that, and Kellen spoke to this too, there's services that are being built. The state has expanded mobile crisis funding as a Medicaid benefit. It can now be paid for as a Medicaid benefit. With that comes some contractual requirements set by both the federal and state governments. And we, to meet these contract requirements, there will be a new contract in place on January 1st. I think that someone's going to speak to the work going into that, but Summit County, Eagle Valley Behavioral Health, and Rocky Mountain Health Plans have released a letter of intent for interested providers to provide mobile crisis response starting January 1 of 2024. And then also the state has provided, I think it's through the BHA, the Behavioral Health Administration, direct funding to Eagle Valley Behavioral Health to help support some of those high intensity services that Kellen mentioned. Assertive community treatment for adults, crisis stabilization, and other community intensive treatments, in home, in school, in the community kind of services. And I think that EVBH is going to talk more about that, so I don't want to steal your thunder, Katie. I wanted to shift to crisis to touch on this a little bit. What we have seen in Summit County is actually really remarkable for mobile crisis response. Compared to the rest of the Region 1, which is the entire Western Slope and Larimer County, the response rate, when they're called, they go out. It's about 90%. They're not always called to go out because sometimes it goes through the statewide hotline. So this is actually a really good response rate. It's meeting the average, and it's almost 100%. The other thing that I think is really critical, and I would attribute this to the work that Building Hope has done and the therapists in the room, you all are making appointments available within 7 days after a crisis response. This is huge and incredibly important. And if you look at the rate compared to the rest of Region 1, which obviously we've got some work to do, in Summit County it's 81% that an appointment is actually available. Not just offered like, hey, if you come in at 1 o'clock on Wednesday, you know, we'll have a therapy appointment, and the person says, well, no, I have a baby and I don't have childcare. Appointments are actually made available for people within 7 days. If we don't follow up with somebody after a crisis response, they will most likely be in another crisis or worse. So I just wanted to show that in Summit County, you all are doing a remarkable job as a community. So thank you. I also, this is data. I am not a data person, and I really tried to put this in plain speak. But if you really want to get the data, that's the data nerd. He can explain it to you. But the way my head sees this is that over the past almost 5 years, since state fiscal year 2019, the access to care and unique providers delivering services has grown exponentially. It has increased by 101% since fiscal year 2019. And I will tell you again, it wasn't because of a community mental health center, it was because of the independent providers that are doing this work. And this deserves a round of applause as well. Now to the bummer slide a little bit. You're still behind. When we look at the services that were delivered up until, I think this is Q3 of 2022, we have a little bit of lag in our data because it's claims data that comes into us. With both services provided by the IPN providers, independent providers in your community, and the community mental health center that has historically been in this community, there are still gaps compared to the rest of the region. You are still having less access to care, and there's less unique service encounters like every therapy appointment. I will tell you, I am hopeful and very optimistic that Eagle Valley Behavioral Health is the new community mental health center for Summit County, and I really do think that in another year, the blue line will be where the gray line is, or even like higher. And so I really do feel very hopeful about this, and we will support it, and we will invest in it to get you all to where you need to be. And the Region 1 averages even need to be higher, but we can get there together as a community. So Patrick, did you want to round anything else about the data? Because that is our last slide, I believe. If you want to say anything else?
Yeah, I'd just say that data is really important, right? We know that this community is in motion and that tremendous capacity has been built in a short period of time, but we don't know where we stand unless there is transparent feedback. And the reality is that we've got a lot of work to do. A lot has been accomplished, the trends are moving in the right direction, but as long as that gray line is below the blue line, people are not getting what they need. So that's our focus. We want to close that line however we can.
So I'm going to hand this off back to Kelly. Sure. And all questions later, informal or formal, please grab me or Patrick, and we're happy to talk. Thank you so much.
Thank you, Megan, Patrick, so much for explanation and data. Next, we're going to welcome Vail Health Behavioral Health, Katie and Dr. Miles. Here behind this. Try not to, make noises. Okay, we'll see.
Hi everyone, my name is Katie Spitak and I am a behavioral health provider with Vail Health Behavioral Health, also Eagle Valley Behavioral Health, Mountain Strong, soon to be the Precourt Healing Center and Uyghurs Mental Health Clinic. I'll explain kind of what all those services are. It's great to be here. To share the services that we offer and to, discuss more how to respond to crisis and hopefully prevent them from happening in the future. As a provider in the community, I can definitely feel the strain that my patients are coming in with, and it's nice to know that on a higher level, the data is showing and we're getting more services to come and more funding to promote the great work that we're all doing. So, okay. Yeah. Oh, there we go. Okay. Spacebar. Okay, so Eagle Valley Behavioral Health, also known as Vail Health Behavioral Health, has been in Summit County for 2 years, but it started off as just me, and it's really exciting that we are the designated community mental health center for Summit County as of July 1st. So we are expanding, which is awesome. But that also means, I believe, that we're also collaborating with the community, and it's not just the services we're providing, it's coming together and being able to have more cohesive support for everyone. But we are located in the Frisco Health Center, which is on Main Street. Right now we've got 3 on-site clinicians that are full-time, that includes myself. We are also going to be having psychiatry on rotation. All of our patients do have access to our psychiatry services, although right now they're located in Eagle County, but they do telehealth. It's great. And we have Dr. Miles here to speak about medication management. And then we also have case management that's soon going to be coming to Summit County on rotation, and they're located in that corner to provide some more information around case management services. As has been discussed in the previous 2 presentations that I cannot speak more of than has already been shared, but there's a letter of interest and work towards having a more expansive crisis and stabilization services here, similar to your Hope Center in Eagle County. And right now, the space that we are in is expanding to be offered we're sharing space and cost so that other private providers can have access to, I think, lower cost space to provide more therapeutic services. And if I'm getting any of this wrong, please help me out, because I'm just a provider and doing my best. Okay. So what does it mean to be a community mental health center designation? This kind of represents what's, I think, more aligned with what's happening in Eagle County, although our services are, you can go between the two. What our patients in Summit County can access all of these and vice versa. So kind of the different tiers going from universal supports all the way up to what will soon be our inpatient services, which is going to be pretty awesome. Oh, how do I go back? So we've got a bunch of behavioral health outpatient clinicians. Here are all our faces. That's both psychiatry and outpatient therapy. We've got 4 psychiatrists full-time that, again, all our therapy patients have access to in Summit County. 12 outpatient behavioral health clinicians, 3 here, 2 are bilingual in Eagle County. So that's all of us. And then we got 2 new psychiatrists, including Dr. Miles, who started in May, and Jessica C., who's starting at the end of August. Both are child psychiatrists, which is a huge demand and need in our community and in Eagle County as well. This slide speaks about our case management services, which are also available to folks in Summit County. I know there's great case management already here, but more is more. And so, yep, they help folks in the community find a therapist, set up appointments, arrange transportation, get connected to all the wonderful programs available, make sure that they can have access to care, insurance, Medicaid, all those good things. I also just learned that we are part of an alcohol support hotline with Your Hope Center. That's 24/7, which is a great resource. Folks in this community also have access to that. It's a hotline for anyone who's struggling with alcohol use issues, or family members, friends who want to find out how to get more help in that way with substance use issues. Oh no, what did I just do? Shoot, I'm so sorry. Oh my gosh. I'm trying to, okay. Jeez Louise. Thank you.
Yeah.
All right, so we also have peer support, similar to what Building Hope also offers in Eagle County. And again, you know, clients can be, thank you. Clients can be, you know, referred to both sides, and folks, you know, go between both counties too. So that's through Mountain Strong. Another available resource is through Speak Up, Reach Out, which I'm sure many folks have heard about. They provide a lot of conversations, trainings for providers, and different programs for those in the community to also respond to and prevent suicide and provide training. And as I was talking about before, we are going to have an inpatient treatment facility called the Precourt Healing Center, which is really exciting. It's going to be 28 beds, 14 for youth, 14 for adults, and that's anticipated to be happening winter 2024 or spring 2025. Ground has been broken, construction has started. It's going to be pretty awesome. And here's some contact information. We've got our caseworkers here. I'm here with some cards. If anyone has any questions around getting access to our services or want to find out more about what we do, please feel free to reach out. And I'm also a provider here if anyone wants to reach out for any support regarding what we're all here for.
Thank you so much, Katie. Sorry, I'm like scaring everybody with this microphone over here, so I apologize. So next we have, we don't have any slides, but I want to invite Megan, where are you, Megan, to come and talk from the Behavioral Health Administration. briefly, and then we will open it up to questions and conversation from the audience and to any of our community partners. Thanks, Megan. Thank you so much, Kevin.
Hello, everyone, and thank you for having me here. Trying to get over my fear of microphones. And this experience, I'm going to try not to make it make noise. I am Megan Shelton. I go by she, her, hers pronouns. I am the Division Director of Intergovernmental and Community Engagement at the BHA, the Behavioral Health Administration, for those of you that are not familiar. And so I did not bring slides, and that was very intentional. I have been in this role officially since July 8th as the Division Director. However, as of March 6th, I was serving interim as this Division Director. And in that role, I was really listening to what people have to say and your feedback. I don't know if any of you have participated in our town halls. The first town hall that I facilitated in March, the feedback after that was, we don't want your fancy slides. We don't want to hear you read to us and tell us all these things that we can look at that we already know. We want engagement, and that's something I'm really, really excited about. Kind of some history on where I came from. I started in behavioral health in 2001. Working a lot of trauma recovery counseling has been the majority of my career, the first 16 years. And then everywhere that I've worked, I've kind of found myself in progressive leadership roles, which is really exciting to be where I am today. I look back and I think across the years, how many kids I've worked with where I've watched the system fail them. And there's names that come to mind for every single task force, steering committee, advisory board that I've had the opportunity to serve on. I think, okay, this work today, this is for Catherine. This is going to change the world for Reniqua. If this had been in place 20 years ago, this wouldn't have happened. We wouldn't have lost this child. And to be in the opportunity where I am now, to start making a difference so that the system doesn't continue to repeat itself is, and fail children, is an honor. And I can't do that without listening to each of you. I can't do that without that community engagement and interaction. And so my goal is not to talk at you, but to hear you, to dialogue with you, as well as give you a little bit. I did bring some notes with me, just to give you a little bit of history for those of you that don't know what the Behavioral Health Administration is. So Governor Polis, when he was first elected to office, he was very transparent with his passion and his dedication to fixing the broken behavioral health system in Colorado. We're making it better for all of you throughout the state. And so that started in 2019 with the Behavioral Health Task Force that had many different subcommittees that focused on different areas. And they went throughout the state listening to people, listening to the stories, listening to what went wrong, where were the people of Colorado failed, where did we not meet their needs, and how do we meet their needs? What do we need to do to fix this? And so the Behavioral Health Administration was established, and it started in July of 2022. And with that, we have developed a strategic plan looking at how do we bring access to care, affordable health care, so that that's not a barrier for people getting the services they need when they need it. Workforce support, obviously very important. Accountability, being able to ensure that people are getting the services they need that are quality, that they're effective. And that they're efficient, that it's not really challenging to get the services. And by listening to our consumers and local guidance. So another way that we have that is we have a advisory board of lived experience. They're the Behavioral Health Administration Advisory Council. And I meet with them very regularly. They are folks throughout Colorado with lived experience, and they advise us on all the work that we're doing. And sometimes their feedback is hard to hear, but I love that feedback that's hard to hear, because that tells it's honest, and it guides the work that we're doing. So with all of that, I think that covers all of the main points that I have in regards to what is the BHA. And what I need from all of you is to engage with me, reach out to me. Let me know what your questions are, let me know what you need, let me know what we're missing, what are we forgetting. So thank you for having me here. It is an honor to be in this room with all of you, and it's really exciting to hear what's happening in Summit County. I had no idea that so much work was going on. I know that there's always room for improvement, but listening to the trends that were presented tonight, it's going in the right direction. It's not perfect, but we're headed in the right direction, and we have the supports, and we have so much passion here to make a difference.